Today I hope to actually share with you knowledge regarding the cost of retirement, the cost of healthcare in retirement, and hopefully through this process I'll be answering the questions of why is healthcare so expensive? What should I budget for, and what strategies may help me now? Why is healthcare so expensive? So I had the privilege of reading the Journal of American Medical Association publication, which was published in 2017, a 17-year overview of what's been happening in healthcare, okay? And they pinpointed 5 key factors associated with healthcare increases. One of these being population growth. I don't need to tell you that you guys are in the largest segment of the population. I'm included in this too. Aging population, thank goodness we're living longer, okay? Disease prevalence or incidence, and medical service utilization, and service price and intensity. Those were the 5 key factors they identified as the key reasons why healthcare is increasing. Why is healthcare so expensive? Well, the increased ambulatory costs, that's emergency room care, that's outpatient surgery service costs, those have increased. If you look here, the outpatient costs rose from an annual cost of $381 billion to $706 billion over the 17-year span of time. Increase in chronic illness, diabetes. The Centers of Disease Control, the CDC points out that diabetes is the fastest growing disease in America. Coupled with that, the medication associated with diabetes is extremely expensive. So ultimately, be aware of your health and stay healthy. At this very moment, there is no transparency. I don't know, when was the last time you guys went to the doctors and you received a bill, and how frustrating that is, going through the equation of what is this for, how am I supposed to, who do I pay, how often am I paying, why am I being double billed, and so on and so forth. I can't tell you the number of individuals whom I help sort through a sticky mess as medical billing. There's absolutely no transparency in it at this time. President Trump actually has an executive order specific to our healthcare system, has long hidden the true cost of healthcare, keeping critical information from patients' hands and limiting competition. Unfortunately, it's staggered in progress because of all of the hands in the pot that don't want transparency to happen. What should I budget for? What should I budget for when thinking about the total cost of healthcare in my Medicare future? Okay. Financial publications indicate a married couple will need anywhere from $250,000 to $415,000. That's over a 30-year span of time. That's a big value. Medicare and the types of coverage are not uniform, so be aware of this, and we'll get into that in a minute. Shifts in the economic landscape and changes in the governmental regulations are difficult to predict, which also causes an issue on how do we hone into what is the correct value up here during your time in retirement. But these key factors are pretty important when looking at the overall perspective. Healthcare is not a one-time bulk expense. We should look at this rather in a monthly expense and plan for that. What I did was I separated fixed costs, the premiums, from predictable costs and variable costs, meaning my fixed costs, I know I'm going to be spending monthly premiums every month. What are those? I don't know yet. We'll get into that. But other things, predictable costs, when you are in your aging years, I'm right there with you. I just turned 50. Yeah, I can't wait to be in Medicare, honestly, because health insurance is so expensive. That being said, we have predictable costs, scheduled surgeries. I know eventually I'm going to need to have my shoulder done. I know eventually I'm probably going to have my hip done. What is that going to cost me? And when do I want to get that accomplished? Do I want to get it accomplished now where it's going to be more expensive, or do I want to push it off later when I know I can manage those costs because I know that Medicare policies are a little, actually Medicare policies are less expensive and they provide a little bit more coverage than what I'm currently in now in an individual policy. Okay? Each family's health situation is different, and it's different now and it's going to be different 30 years from now. Okay? Here is an overview of really, and I hope that we can walk through this as just a high-level thought process of what really are the types of Medicare coverage. 1, you have straight Medicare. 2, you have a Medicare supplemental program. And the 3rd is a Medicare Advantage plan. Okay? So let me say that again. And I do expect that you guys in your future now regularly speak to Medicare professionals who can help you through this equation, because it took me probably 18 months to really feel comfortable about what Medicare is and all the parts and pieces that are associated with it. And it's not a one-time conversation. It's not something that, okay, yeah, I think I kind of understand it. No, you really should be more involved with the process of what kind of Medicare policies you have, what actually happens every year. You probably already are aware that Part A is an entitled benefit that you've been paying into your entire working career, and it covers hospitalization. It has a little bit over $1,000 deductible should you be hospitalized. Part B is something that you pay for. Part B is something that is annualized every year. Last year, the Part B premium actually, for 2020, it increased to $144.60. You probably don't really know that because it comes out automatically from your Social Security check if you're drawing Social Security at this time. So if you're not physically writing the check to CMS, Centers for Medicaid and Medicare Services, that Part B premium can kind of creep up on you, and all of a sudden, oh my gosh, it really is $150, or it's $144.60. But each year as this increases, you should be paying attention to that $8 increase, that $5 increase annually. Am I making sense? Good. Also, Part D, drugs, your drug card. That is something that if you have just straight Medicare, you have your entitled Part A, you're paying for Part B, it might be coming out of your Social Security check, or you're physically writing a check to CMS, and then maybe you've purchased a Part D drug card, okay? Or the other idea behind Medicare policies is a supplemental or Medigap plan, okay? A Medigap plan takes into consideration A, B, and actually fills in the gaps. So Medigap policies are a little more pricey, okay? They are based on your age and they're based on your gender. So as you age, those prices are going to increase, okay? However, Medigap policies actually cover much more than a Medicare Advantage program. So it really depends on your health. It depends on your individual finances, on what you can afford and what you can't afford, and your health, on how much do you want to protect yourself in the future, okay? Medicare Advantage programs are really unique, and actually this last Medicare renewal open enrollment cycle, we'll call it, I've noticed the immense amount of commercials. I don't know if I can see another commercial with, who is it, Joe Namath. Yeah, and who's the other guy? He looks horrible. He does. Anyways, they're advertising Medicare Advantage programs. And a lot of this is like, maybe you're flipping through the channels and you're like, geez, oh Pete, here I'm hearing this again. Here are these other things of these little tiny threats of don't miss the opportunity to have dental, don't, you know, and really kind of edging on kind of an open thread of, oh, do I have the correct policy? Am I in a space where I feel comfortable? Or flip the pancake, You see advertised commercials out there for $0 premiums. That may be good for some, but those $0 premiums also open up risk later on if you're not familiar with how the policies function, okay? So, high level perspective, this is straight Medicare. This is Medigap. We've got the supplemental where the Medicare policy or the Medigap policy fills in the gaps, okay? You will have to purchase an additional drug card, okay? Or you have Medicare Advantage, which is all in one package. Make sense? Okay, and each one of these, this is a higher price vehicle. This is a lower cost vehicle, if you will. But in the lower cost vehicle, your expenses are going to be higher. In the higher price vehicle, your expenses are going to be lower. Make sense? Okay, so what I did here to really look at the overall perspective of really the expense of healthcare in retirement, I personally have the privilege of speaking with couples a lot. And I get to know them intimately in the fact of, I don't like to sell them something and then see you later, goodbye. I like to actually share time with them once, twice, 3 times to let them know, hey, let's go through the actual policies that are in front of you and make sure that you feel comfortable. Because sometimes in the world of Medicare, people just sign up and then they, okay, see you later. I don't want to monkey with this. And then all of a sudden something happens and there's risk or there's usage. There is an illness. Someone needs to go to a nursing home. Somebody needs a hip replacement. And then all of a sudden the understanding to how these policies really function hits you really fast and swift, and you need to make sure that you've already done the education beforehand. Does that make sense? Okay, good. Okay, so here's an example of Bill and Betty. They're both 65. They've been married for 40 years. They're a healthy couple and will be retiring at the end of the year. Okay? They've been saving their entire career for retirement. So right here, I have Bill and Betty. Bill is actually, you'll see here, these are real prices from supplemental programs. Plan G, that's the best program, Medicare Advantage program, or excuse me, Medicare supplemental that you can purchase these days if you're new to Medicare. Bill's Part B Medicare annually, or excuse me, monthly is $144.60. He conveniently started drawing his Social Security and has had that withheld from his Social Security pay. Red flag, be aware, again, if you have that, it'll come out automatically, and every year as the Part B premiums rise, you really, unless you are investigating that or unless your insurance agent is informing you of that, it's gonna, you won't be paying attention to it. Okay. Supplemental Plan G premium cost for Bill is $125.63. He's relatively healthy. He doesn't take any medications, but for his own protection, he's going to purchase a very basic drug card at $25. His monthly fixed cost is $295.23. His wife, Betty, same scenario here. She's $144.60 Part B premium, but she's a female, so her prices are a little less, okay? $119.65. Total fixed for her is $289.25. We annualize this, it's $7,013.76 annually, all right? If something catastrophic happened to Bill in the Medicare supplemental program, medically, his out-of-pocket expense is $185. Not too bad. If his drug card, and I have an asterisk here just because drug cards are unique. They operate in 4 phases, and each drug card that is out on the market has a little bit of a different variable. And those variables depend on, obviously, where the drugs, what the insurance carrier is, the distribution channels of the drug card. So I just want you to know that this might not be the case, but worst case scenario-ish, okay? It could be that if he was on medication and all of a sudden something happened to him, we're looking at his annual risk, okay? Health and medication is $6,535. Here's another scenario. Married couple, Daniel, he's 72, and Donna, she's 70. They've been married for 5 years and they're snowbirds, and they traveled to Florida for 6 months, okay? They've decided to purchase a Medicare Advantage program, a PPO, but yet they still have to pay for the Part B of Medicare. That's still going to come out of their Social Security check, or they're going to be writing a check quarterly to Social Security or CMS. Okay, their Medicare Advantage program for 2020 would run them $205 each. Medicare Advantage programs aren't based on your age, or your gender. They're based on the region of where you live. Inside a Medicare Advantage program, they do have some dental coverages. Okay, so be aware of that, and a minor hearing benefit, and silver sneakers and all that fun stuff that Joe Piscopo, no, Joe Namath, thank you, talks about, correct. Okay, so we have here Daniel, he's going to be paying for $144.60 for his Part B, $205. His total monthly fixed is $349.60. Same holds true for his wife, Donna. So their annual cost is $8,390, their fixed cost, right? But if something catastrophic happens, the unknown, right? And for this year alone, if something medically catastrophic happened, he used all the features inside his Medicare Advantage program. He's looking at his out-of-pocket expense is $3,500. Okay. If something catastrophic happened inside his Medicare Advantage program and he was prescribed medications, in some of these Medicare Advantage programs, chemotherapy drugs are run under the RX benefit. So that can add up rather quickly. In a drug card or Part D, they operate a little bit differently. Okay. So if I'm looking at Daniel and he had a really bad year, he's looking at his medical expenses as $9,000, basically $9,850 for his annual risk. Same holds true with Donna. So collectively together, their annual risk, if they've had a bad year, I know I've had some bad years, and if my spouse had some bad years, we're looking at potentially $19,700 of risk. So we're going to round that up to 20, and we'll round this up to 9. So that's just 1 year. Okay. Let's see. Here's something interesting. Here's Ralph and Rita. They're a married couple. Rita's 60. She's not yet 65. So what do we do here in this situation? So in some cases, actually, like I personally had a couple that just traversed through this situation. The husband decided to retire. His wife, 5 years younger. He had the opportunity of COBRA, okay, where his wife, when he came out of the working group, okay, his wife was able to stay on the group benefit until actually for 36 months. After that 36 months ends, she's pretty much going to be paying full sticker. She does not apply for a subsidy. But ultimately, age 50 to age 64 and 9 months is the worst pocket to be in for health insurance. And really, you need to add a 0 to your age, and that's pretty much your monthly premium. Okay, so that being said, we have Rita in a pre-65 plan, and Ralph, they didn't budget for this. So Ralph decided to purchase the $0 Medicare Advantage program that Joe Namath advertises, okay? If something catastrophic happened to Ralph, we're looking at he using all of the features inside the Medicare Advantage program. $5,300 is his out-of-pocket expense. Again, here we are in the value of the medications that are built inside the benefit, the drug benefit inside the Medicare Advantage program. His exposure could be $6,350. All day we're looking at an annual risk of $11,650. Rita, if something catastrophic happened to her, because this is a pre-65 medical plan and it has to follow the same features of the Affordable Care Act, in purchasing a policy in 2020, her total out-of-pocket exposure is capped, and in this specific policy, it's $8,150. So if anything catastrophic happened to Rita, hip replacement, hit by a car, whatever the circumstances are, she's looking at $8,150. Okay, so her annual risk, or the couple's annual risk is, again, here we are nearing $20,000, $19,800. Annually, they're going to be spending $8,935. Okay? What should I budget for? Of the three scenarios, the annual fixed premium costs, I've averaged this out, and these are situations that have, these are real life situations, real life dollars here. So we're looking at an annual fixed budget of $8,113.12. Okay, so let's just keep it easy, $8,000 a year. Okay, just for the premiums, not taking into consideration surgeries, services, dentures, and I didn't even touch on long-term care. Okay? Okay. Without factoring in inflation either, we're looking at over a 30-year period of time, we're looking at $244,000. Okay? What should I budget for here? The risk. Of the three scenarios, the average risk is $17,523.33. That's if everything horrible happened to these couples in 1 year. So the average is $17,500. Now, I took into consideration we have bad years and we have good years. Sometimes we have 2 bad years in a row. Sometimes we have 2 great years in a row, so on and so forth. But I used a 15-year and multiplied the average by that and came up with $263,000. Okay? So ultimately, we're looking at potentially $507,000 over a 30-year span of time. So what strategies can help me now? What can I do to prevent this? What can I do to actually make it better for myself with this glooming picture of a pretty heavy medical expense in my retirement future? Well, get up to speed with Medicare. Many Americans assume that Medicare is free and covers all their retirement. Get to know your Medicare policies. Medicare requires premiums and doesn't cover most dental care, does not cover most or a large chunk, okay? Prescription eye exams, hearing aids. Sometimes there's only a $500 benefit in these programs. $500 doesn't even cover the battery, okay? Then we also have the review annually, I can talk this morning. Do it. Review. Talk to your friends and family. Talk to your experts. Make sure you understand what it is that you have and what strategies can you do to maneuver. Even if it's just planning a surgery if you can plan a surgery, if you can during that time, within an annual time period, plan it and pay attention to when your deductible renews and when your out-of-pocket expenses are going to renew. That's going to help you immensely. It really will. Know that Part B premiums increase every year by a small margin, but they do. Okay? Know that if you're one of those lucky ones that earns a good living and into your aging on to 65, your Part B premium is connected to your what you've reported your income to. So if you're above a certain threshold, your Part B premium won't be $144.60. It might be $300. Talk to your CPA, talk to your financial planners. Let them know, hey, I'm concerned with this, so on and so forth. Okay, so now we have an overview again of, just so you guys are aware, if you have straight Medicare, you're going to be open to a huge risk, potentially, because you don't have the protectors that are going to protect you somewhat. Supplemental programs are more expensive, but they're going to cover more. The Medicare Advantage programs are less expensive, and they're not going to cover as much, but they'll cover some, okay? Know that there are certain time periods when you can enroll, and know that there are certain time periods that you can actually hop from plan to plan. Know that when you're in a Medicare supplemental program and you decide to hop out into a Medicare Advantage program, and maybe then you discover you're not feeling very well or you're going to have high medical costs in the future, getting back into something that's going to protect you more might not be an option for you because they go through medical underwriting, okay? When to retire? Waiting until you're 65 years of age and become eligible for Medicare, okay? I can't tell you, I have a friend of mine actually, she's called me up, she's like, oh, my husband and I are going to retire. I'm like, you're not yet 65, what are you talking about? This is the worst time for you because ages 50 to 64.9 is the highest. If you don't qualify for a subsidy, you're going to be paying high sticker for your Medicare or your medical coverage, okay? Taking Social Security benefits, pushing that off as long as you can so you can capture the biggest Social Security payment to you is a great strategy as well. Talk with your employer and HR department while still employed. Make sure that you get a full understanding of does my employer have retirement benefits? Do they have a resource for me? What benefits can my spouse, if my spouse is younger, utilize? How do I traverse through this situation? Making sure that you're communicating to your HR department in a timely fashion. If your spouse can have COBRA, I think we mentioned that too, yeah. Other strategies, maximizing your tax advantage savings accounts, filling those buckets up. So you can actually take advantage of catch-up contributions. Anybody know what a catch-up contribution is? Good, okay. So if you're in a 401k, you can have an additional catch-up contribution of $6,000. If you're in an IRA, $3,000. If you're in an HSA, $1,000. Very important note is that when you turn 65, you can no longer make contributions into an HSA account. Cannot do it, okay? Note that your HSA, if you have a large HSA account balance, you can invest those HSA funds, right? There's a lot of banks that do that. There's HSA Bank. There is, Schwab has a separate platform for HSA investments. Talk to your advisors, ask questions, okay? The resources that I used, actually, Fidelity and T. Rowe Price, the FDA, health insurance coverage, the census for 2018, and the American Medical Association, and just my knowledge of being in the business for a little over 10 years.